Hey everybody, this is Dr. Vince over at FTR in Joliet. Run a physical therapy clinic on Infantry Drive. Over the weekend I was asked about IT band syndrome. Typically what we'd find for somebody who's saying they have IT band syndrome, and usually the patient's coming in telling us they have IT band syndrome. Usually for something that we'd find is pain may start up here in the hip, radiate a little bit down the leg. I don't see it as a diagnosis frequently in the clinic, but I do get that lateral hip pain diagnosis frequently. Okay, and so when a patient comes in saying they have IT band syndrome, the first thing that I have to do is educate them. And IT band syndrome is very controversial in the research. So much so as, what is it? You know, does it exist, and does it exist how we think it exists? It used to be that we believe that there were these adhesions that would happen on the IT band that would cause it to adhere to the skin above it, and the IT band would be so tight that it would, flicker over the outside portion of the knee every time that you would run at roughly, 20 to 30 degrees. Now we know that, we can't really stretch the IT band. The IT band can take a lot of force, so stretching it isn't necessarily the most effective. So the question is the IT band itself the problem? Usually the answer is no. I've only seen one where I've actually had to work at the muscles that are attached to the IT band in order to reduce the symptoms, and that's in 10 years. So again, when a patient comes in with this outside hip pain, a good practitioner is going to go through a whiteboard, a differential diagnosis, and what we know is that that symptom could come from the lumbar spine, so the low back could reproduce this symptom. That symptom could come from the SI joint. It's not often, but it could. And the symptom could come from the hip. So before we actually get to the muscles that attach to the IT band, we have to rule out 3 other things that could cause it. And the lumbar spine being one of the bigger problems that could actually occur to create this symptom. And so typically the first day we're going through repeated movements of the lumbar spine. We may poke on your lumbar spine a couple of times to see, can we reproduce that symptom, or can we shut that symptom off? If we can move your spine and change this symptom, then the spine gets ruled in. If we've moved your spine in a bunch of different fashions, and we've pushed on your spine in a bunch of different ways, and your symptoms are unchanged, okay, that's one less thing for me to look at, and we can move on to the next step. Okay, so as you can see, before we actually get to the soft tissues that surround the IT band, we have to rule out a few things in advance. Now let's say that we've made it through this algorithm and we've ruled out all of these possible things that could cause that symptom or could refer pain to that area. Then we would go to the soft tissue. The research actually shows to get the muscles around the IT band stronger, so you need to have stronger hips and stronger muscles surrounding the knee in order to reduce the symptom. Those exercises are fairly easy, and you can find those exercises on my YouTube page or on the Facebook page for FTR. If you have any other questions, feel free to comment below. I'd love to hear them. This is Dr. Vince from FTR signing out. Have a good day.